Hi, I'm Dr. Agnes Wojciechowski, and my talk is about the complex nature of presentations in peri- and postmenopausal women. My disclosure is that my company Bio-Alai offers various nutraceutical products for the aesthetic industry, but I won't be talking about them today. What I will talk about is why the perimenopausal patient is so complex, and I'll focus on the gut-brain-skin connection and how it relates to aesthetic presentations. I'll also look at how estrogen and estrogen deficiency affect each component of this communication pathway and how diet and supplements can help support this demographic of patients. So the effects of estrogen deficiency are really most apparent in the external signs of aging, and there is a large discrepancy in the rate of facial aging between men and women during middle age. So the impact of estrogen deficiency is undeniable, but estrogen replacement has only had a minimal impact on aesthetic presentations, and that's because there are many other factors at play. So at any age, women are at a higher risk of developing a chronic condition than men of the same BMI. They are more likely to have insulin resistance and more likely to have hypertension and non-alcoholic fatty liver disease. And by the time they reach perimenopause, almost half have been diagnosed with a chronic condition. 60% are overweight or obese, and 22% have a mental illness. Women are also 4 times more likely to be diagnosed with an autoimmune condition than men. And what's interesting is that the onset of autoimmune conditions tends to occur, or the relapse of them tend to occur during hormonal transitions at puberty and pregnancy and menopause. And that's because estrogen and progesterone regulate immune function, and they're generally anti-inflammatory. So when their balance is disrupted in these transitional periods, there's a pro-inflammatory state that drives not just autoimmune conditions, but any chronic condition. But what's really important to understand is that all conditions have a multifactorial etiology that generally stems from the effects of a Western diet and lifestyle on the gut microbiome. So what's been found in the research is that metabolites produced by a dysbiotic gut microbiome increase permeability of the gut wall and activate an inflammatory response through specific T cells that are located in the gut. Now, 80% of all immune cells are in the gastrointestinal tract, and inflammatory signals that originate there are transmitted via the bloodstream, along with metabolic and neuroendocrine signals to distal organs. And this is why the gut is really the main source of inflammation in the body. Now, this image on the left shows the T cells, glucose, and insulin signals that are involved in the development of type 1 diabetes. But there are similar links that have been identified for all chronic diseases, many of them which begin or worsen during menopause transition, like psoriasis, irritable bowel syndrome, rheumatoid arthritis, type 2 diabetes, and all of these conditions contribute to skin aging because of the inflammatory process and to various aesthetic presentations. And that's because the inflammatory, metabolic, and neuroendocrine signals from the gut are also transmitted to the skin, where they drive the various pathologies. And that's what's called the gut-skin connection. And these signals are also transmitted via the vagus nerve and the bloodstream to the brain, where they produce neuroinflammation and they activate the HPA axis, which in turn produces an effect in the gastrointestinal tract and within the skin. So that forms the basis of the gut-brain-skin connection. And all of the presentations that are commonly seen in menopause have this connection at their foundation, with a specific gut microbial profile, a specific T cell response, and activation of the HPA axis. But estrogen plays a key role in the transitional period because there are estrogen receptors on immune cells, on skin cells, and on neurons, amongst many other organs in the body. So estrogen supports skin health directly through receptors on skin cells, so it helps improve skin integrity and collagen synthesis, and it acts indirectly through its beneficial effects on the gut microbiome, on immune cells, and on neurons. So I'll take a closer look at how all of this works. So estrogen increases the diversity of the gut microbiome and the integrity of the gut wall, and it also guides T cell differentiation towards T regulatory cells, which are anti-inflammatory. And in return, the gut estrobolome regulates estrogen. The estrobolome are bacterial genes that secrete enzymes like beta-glucuronidases, and these deconjugate estrogens back into their active forms to enable recycling of estrogen, and this supports estrogen levels. So the expression of the estrobolome changes with dysbiosis from any cause, and this will change the level of circulating estrogen, so they can increase or decrease depending on what species are present. So maintaining a diet, a healthy diet and lifestyle that support a healthy gut microbiome during menopause becomes even more important. So estrogen also has a really potent anti-inflammatory effect by inhibiting the activation of the inflammasome. This image shows its protective effect in neurons. So on the left, you can see in the premenopausal period, estrogen inhibits the inflammasome activation. And as estrogen declines in the perimenopausal period, the inflammasome becomes activated. And when this happens in the skin, the inflammation and the oxidative stress that occur cause rapid skin aging, and that sets the stage for other dermatological manifestations. Now, one thing I did want to point out is nuclear factor kappa beta is a potently pro-inflammatory nuclear factor in immune cells, and it's a treatment target for anti-inflammatory nutrients that I'll talk about towards the end of this talk. So in the brain, estrogen is also neuroprotective. It protects the blood-brain barrier, it reduces neuroinflammation, and it supports all aspects of brain function. So it supports memory, cognitive function, mood, sleep, appetite regulation, and also regulation of the HPA axis or the stress response. So this is why women experience brain fog, memory problems, and anxiety and other mood disorders when estrogen declines. So this image just summarizes the gut-brain connection that occurs with fluctuating hormonal levels and how it relates to irritable bowel syndrome and mood disorders. So as estrogen declines during menopause or the transition, gut microbial diversity decreases and gut permeability and inflammatory markers increase. And the inflammatory and metabolic and hormonal signals are transmitted to the brain where the stress response is activated. And one of the biggest issues as we age is that this chronic stress response, which is driven by cortisol, produces structural changes in the brain that are really difficult to reverse because neuroinflammation reduces neuroplasticity, and neuroplasticity is essential to help rewire the brain. So with neuroinflammation, you just have this chronic activation of the HPA axis and the stress response, and that then the cortisol that's produced will then communicate with the skin, and the skin has its own stress response, and it's initiated by these internal signals or by external stresses like UV radiation. And these go on to activate mast cells to produce histamine, and they activate the skin's HPA axis, which produces corticotropin-releasing hormone, and that communicates with the adrenal glands and with the brain. So it follows this self-perpetuating cycle that's driven by histamine and cortisol and estrogen deficiency, and it presents with all of these skin signs and symptoms. So cortisol, I'll just go through a couple of key points as far as cortisol goes. It's linked to hair loss and graying because of its effect on the hair follicle. It's in lab studies, cortisol has been found to inhibit collagen synthesis in dermal fibroblasts, and in humans, cortisol and the HPA axis in general is linked to many different skin conditions. So I'm going to talk a little bit more about rosacea because it's so common in the menopausal transition, and it has features that overlap with the hot flushes of menopause. So rosacea is characterized by dilated vessels and facial flushing, and it occurs due to various dietary, lifestyle, and environmental triggers. And these triggers are the same ones that can cause the hot flushes and also increase skin reactivity during menopause. Now, there is a very clear gut-brain skin connection that's mediated by a histamine that originates in the gut due to a specific gut microbial profile that initiates the release of histamine from mast cells. And this is then transmitted to the skin where it dilates vessels and causes inflammation. And it's also transmitted to the brain where it causes neuroinflammation and activates the stress response. So people have this relapsing, remitting cycle of symptoms that are worse due to stress, worse during menopause due to a lack of protective effects of estrogen. So estrogen protects vascular and endothelial as well as the gut and immune and skin and brain. So any stress, whether it's physical or emotional, internal or external, will exacerbate the process. So during menopause, during the transition especially, it becomes even more important to get inflammation and histamine and the stress response under control. And that means addressing all of the modifiable factors that contribute to dysbiosis, chronic inflammation, chronic disease, and chronic disease. Because even though we can offer these really effective treatments, the underlying systemic inflammation still remains. So there's lots we can do to help our patients, and I'll use rosacea as an example, how we can provide a more holistic approach with using diet and supplements, because the gut microbiome is influenced by diet, and any shift in the diet can produce really rapid changes to its composition. So first and foremost, patients need to avoid foods that are high in histamine and foods that cause dysbiosis. So that's pretty much common sense. And then they also need to include foods that are high in polyphenols and omega-3 fatty acids, because these help improve microbial diversity. They help reduce gut and systemic inflammation, which is why an unprocessed low GI diet has really been found to have the greatest and most beneficial impact on health, all health parameters. Prebiotics, both dietary and supplemental prebiotics, have also been linked to a range of health benefits, including benefits in the gut, in the skin, and in the brain. Now, I've listed some common prebiotic powders that may be useful, but you just need to be aware that we need more than one. So 3 to 4 need to be mixed together, because different species digest different, or preferentially digest different prebiotics, and you want to increase microbial diversity. And also patients need to start with a low dose and then gradually increase as tolerated. The other thing with prebiotics or any supplements is you really need to be careful with the quality, make sure that they're excipient free. It's also a really good idea for menopausal women to take vitamins and polyphenols that support cell function and reduce inflammation and oxidative stress. So vitamin D at a maintenance dose, vitamin A, curcumin, quercetin, and omega-3 fatty acids have all downregulate the pro-inflammatory nuclear factor that I spoke about earlier. And so they can improve gut-brain skin signaling. And there is really good evidence in humans that they reduce systemic and organ inflammation. Quercetin is one interesting one, because it's also a mast cell stabilizer, so it reduces histamine, and it can be really useful for facial flushing and for rosacea. Now, nutrient needs increase with age, and vitamin deficiencies are quite common. So about 80% of obese individuals have multiple nutrient deficiencies, and 80% of office workers have vitamin D deficiency, or that's estimated, that's the amount. So, and our needs increase with age and stress and chronic inflammation and chronic conditions. So a good multivitamin used intermittently can help support cell functions and repair the processes that naturally decline with age. So that finishes up my presentation, and the key takeaway points are that perimenopause is an incredibly complex time, a stage of life, and there is a lot more to it than estrogen deficiency. Estrogen deficiency basically just reveals the gut, brain, skin pathologies that underlie many of the aesthetic presentations that we see. And we can use diet and supplements. These are very safe and effective strategies that can be used as adjunct treatments in our setting at any stage of life. So if you'd like to find out more about how you can incorporate nutrient therapies as an adjunct to your services, come and see me at the Bio-Alai booth or visit our website. Thank you.